achieve that, and then how do we know if we're on the right track? Which is the challenge that we put to the team last week. And so a lot of what I'm going to be presenting now comes out of that conversation that we had last week. So just for those of you that might not know or who need reminding, FaCE has a massive transformative purpose, which we developed about 2 years ago when Steve was leading the department, building inclusive communities of care together. And it's a short phrase, packed with lots of wisdom, and we hope that it can imbibe kind of the type of work that we want to produce, but also the way in which we work and the way in which we develop as academics and researchers. And I think the focus for me is always about building together. The bit in between is important, but the action of building together is what energizes the way in which we hope to see this department going forward. And so we're made up of 5 distinct units. Family medicine, which has been around probably for the last, I think family medicine was a distinct division since the late 90s. So it's about 25, more than 25 years. Palliative care, which became actually it's the integrated palliative care and medicine IPCM division, which as a distinct division has only been around for about 2 years. But the work of palliative care, we're sitting with, been blessed with the presence of the founder of palliative care at UCT, Dr. Zbada. The work of palliative care has been going on for the academic work probably for the last 25, almost 25 years. Yeah. And we know that palliative care is a few hundred years, a few thousand years old. The emergency medicine division has also been around for since 21 years. So we have, so even though we're presenting ourselves as a new department, you'll see that members of our department are not necessarily new, and they have strong academic traction in UCT and beyond. Sports and exercise medicine, which currently is still part of the human biology department, but which is in the process of transitioning into FaCE, and we're hoping that sometime during the course of 2026, that sports and exercise medicine will become a distinct division within FaCE. It will incorporate our sports medicine physicians who have just been promulgated as a specialty in South Africa, and we're hoping to welcome our first registrars in sports and exercise medicine, either in 26 or 27. And they would also incorporate the new 4-year degree of biokinetics into our department, which would be, at the moment, the biokinetics degree is a 3-year degree with an honors, and following HPCSA guidelines, that will be transitioned to a 4-year professional degree. And then the primary healthcare team, which used to be the primary healthcare directorate, which also similarly has about a 25-year lifespan in the faculty, proud history of establishing kind of an ideological lead for the faculty in terms of implementing the principles of primary healthcare, trying to infuse that into our undergrad curriculum and into our postgraduate teaching and into the research and into the way in which we think about health systems in this part of the world and elsewhere. So it's a department which is made up of established identities, established academic identities who are now coming together. And herein lies the interesting challenge for us. Because insofar as we celebrate those identities, in the merging of those distinct identities, we need to find some type of commonality, which gives us some type of common purpose, without diluting the identity to the extent that it loses its core elements. And I thought it might be important for us just to look at our footprint. And it feels massive, but then we start understanding that Western Cape is largely rural. The black dots is where our department is active. The majority of our population lives in the city of Cape Town, and so that's where a lot of our work is happening. But the Eden district is an expanding zone. You'll see we're not extending all the way up the West Coast, and so we need to start asking ourselves questions about how far up the West Coast do we want to expand. Largely our footprint from a teaching research perspective and our clinical work follows the drainage area of Groote Hospital. And so you'll see that Tygerberg Hospital has a much larger drainage area than Groote, but more or less the same population drainage because of the sparsely populated rural areas. So that's an ongoing conversation, and also an area of great opportunity for us to think about. What's the extent of our research and academic footprint in this fairly widely distributed geographical area. And so from this, I came up with these 5 key themes. There are more, but these are the dominant themes that characterizes the research outputs in the last few years in these divisions. Quite a bit of clinical research related to particular disease conditions, and that's useful and valuable and important. I think our clinical research places us amongst clinicians in other specialist disciplines, and we need to strengthen that and continually work at increasing our footprint there. All our divisions, all of them without fail, have done educational research to varying degrees, and I think also quite important because many of our educational programs are in the early years. We don't have programs that have been around for 50 years like some of the other disciplines. And so as we're emerging into a new world where we need to have type of practitioners who fit into the needs of the communities in which they will serve, who are able to serve those needs, we need to be constantly in an organized, structured way thinking about what are our educational priorities that we are implementing. And so educational research for an academic program where a large part of the work is teaching is completely on point. We recognize that health systems in our part of the world, and when I say our part of the world, I'm not only speaking about Western Cape, I'm speaking of nationally across Africa. And so all of our divisions are quite busy, and I'll show you a quick graphic immediately after this slide. But health systems research, which extends not, when we say health systems, we're not only talking about health services, which is a component of health systems. Health systems research, which also incorporates the human dimensions of health services, beyond just the kind of the flow of patients through facilities and in ambulances, etc. One of the strengths I think that this department brings to the faculty is that we are embedded within communities. And even though our outputs at the moment are not reflective of how embedded we are, there have been outputs related to community engaged research, important outputs. But this is certainly for me a key opportunity area, key growth area. Not so much only for ourselves, but I think there's a lot that we can bring to the table in terms of the rest of the faculty's learning around community engaged education, community engaged clinical services, community engaged research. As we start thinking about transforming our faculty into one which is completely socially accountable, these conversations need to become more prominent, and we are the people. Our department is going to be a strong voice in bringing that onto the agenda of the faculty's overall development. And then I must mention advocacy. Once again, when I looked at the type of outputs across the divisions, I was quite pleased to see that every division is involved in some level of advocacy to varying degrees. But they're not just doing, or we are not just doing work, research for the sake of outputs. We're thinking about where our work is landing, and the type of work that's producing is landing in places that's actually effecting change. Now, we don't have a metric at the moment for that, and I think maybe another challenge for us. How can we think about starting to measure the impact of our work over a long period of time? Are we seeing it? All of the work, the inputs that we have, the training of people, the procuring of resources, where is it landing, and what type of sustainable impact is it having in our communities, in our health services, in our educational systems, etc. My kids did the graphic. You can do that again if you like. Someone told me just before the meeting, Sarah, that joy is infectious. What I wanted to do here was to show you the kind of the spread of the thematic spread across the divisions. And what was, when I did this exercise, I was quite struck by the fact that even small divisions with relatively few researchers are actually punching, above its weight. We're touching, almost all our divisions are touching on every aspect of these 5 key themes. PHC, which understandably doesn't have a clinical component to it, is doing planetary health and health humanities work. And so, when I looked at how this panned out in the graphic, I thought, oh my gosh, there's so much potential. Already there's been a great contribution. But if you start thinking about finding cohesion across some of these, so for example, advocacy, one could think, is that a divisional thing or is that a departmental? Is it important for me as a family physician to only think about certain things which are important to family medicine, or is drowning prevention and advocacy for drowning prevention also something which family physicians need to be talking about and advocating for? So advocacy, community engagement, health systems, education, you'll see the only thing where we start to speak about our own distinct identity is in the clinical domain, because we're responding to our clinical challenges. But the other 4 key areas, and then certainly from a planetary health perspective, that should be on all our agendas. Health humanities is who we are. So the far majority of outputs that I've seen in the department thus far indicates that there's great opportunity for internal collaboration and internal cohesion in terms of us developing an intellectual legacy within the department. I think that's quite important. Sometimes we become quite technical, mechanical, industrial about how we think about research. I must develop a proposal, I must get some funding, I must get a team, I must implement, I must publish, I must go through it. It's an intellectual component that I'm worried about losing. A thought leadership that we mustn't lose touch of. Particularly when we find that we're working around the same topics in slightly different ways. Opportunities for us to kind of enhance our own ways of thinking together. We spoke last week quite strongly about being together, and I think that's quite an important kind of place for us to ground ourselves. But then thinking together is something that we haven't spoken about. Doing together we've spoken about. But I think there's an intellectual legacy that's on this slide that's jumping out at me at least. That we need to be really thinking long and hard about, have we thought about setting up some type of place where we just go together to think? And some of you might have had the conversation with me of just an anecdote from another university. Someone came into this person's office and there were no computer, no books, no paper, no pens, nothing. And they're like, what are you doing? Are you not working? I said, no, university pays me to think. I don't need a computer to think. And I think that kind of that intellectual work is something that we must maybe think about as a collective effort. And I must say that the evidence that I've looked at is that all of these divisions, all of them, all of these units have local and global perspectives in their outputs. So it's not as if we've been left out of global conversations. We're there. Our people are there. We're publishing globally. We're collaborating globally. We're doing work locally as well. One just needs to, think a lot more strategically about, what proportion of my time is spent working on local issues, because that's where we want to see impact, and what proportion are we engaging globally? Because I must say, in my engagement with global health issues, global health is like a big black hole that can just suck you up into it. And before you know it, you're kind of spinning along in multiple committees all over the world, and your feet only touching the ground in the place in which you live and work. And so there's that tension that we need to live with, and that awareness that we need to hold. We live in an area of part of the world which is completely underserved by the intellectual project. And so we need to be wary about being sucked up into global issues. There's a lot more politics I can talk about, but I'm not going to get into that. But who sets the agenda? So Angela led a very interesting part of our preparation for this day, and that was around, we did a baseline research capacity survey. We got a fair amount of people responding, close to 50 people responding from different divisions. And the first point to make, I'm not going to go through all the detail, the first point to make is that we have a fair amount of methodological diversity in terms of what people are comfortable doing, and in some instances leading. It was one of my questions, like, are there any methodologies that we are predominantly leaning towards, and are there gaps that we need to look at in terms of building capacity internally? There are some gaps, but I must say I've been pretty impressed with the level of comfort that people have with multiple methodologies. Obviously, to identify the gaps, we need to look at the detail, which is not for a talk like this, but which will form part of the work going forward. While we have methodological diversity, we're strong in that our research capacity is, in my opinion, moderate. I didn't have a scale to measure moderate, strong, moderate. I just made up my own assessment and I said it's moderate, which means it can be strengthened. And this moderation comes mostly from the fact that this is a small pool. We have a small pool of supervisors. We have a large pool of joint appointees who are almost fully immersed in clinical work. And when we ask if they can supervise, oftentimes the answer is, we'd love to, but we just cannot. And that's a nut that we haven't cracked yet. So this challenge persists. The challenge of expanding the supervisory pool. Same challenge persists with, we've got great fundraising success. If you listen to some of the fundis who were about like grant writing fundis, they will tell you, be prepared for more rejections than successes. And we've a pretty good success rate. 61% of all our grant applications are being accepted. But once again, the caveat here is that it's a few people, less than 5 in the department, who are driving this process. So if someone came and gave 2 of them an offer they could not refuse, we'd be in trouble. So if you have offers that you can't refuse, please get them. Significant research output and activity. In the last 2 years, we've had over 120 proposals come through our DRC, and that's significant for a group of divisions that have most of the people out in the clinical services. EM, and this is kind of a failure in EM's cap, but it's a warning bell for the rest of the department, that EM consists of about 60% of the total proposals that came through DRC. So emergency medicine driving the research activity. Either emergency medicine is overactive in research, or the other divisions need to play catch up. What's the sweet spot? What's the balance? What's the point at which we can say we have equilibrium? Are we productive for the sake of being productive, or are the other divisions being underproductive? We don't know. We don't have a long enough track record to know where our equilibrium exists. But it's something that we must also be thinking about as we go forward. So clear gaps that the survey identified, but also clear opportunities. And I think for me, the biggest and most urgent is that we need to expand our pool of supervisors and and researchers who are able to sustain themselves. She said 5 or 10 minutes. Take 10 minutes.
I'm sure the big boss these things.
This is a slide that I used in the previous presentation. It's just to show that our partnerships across all divisions, when I look at the data around the divisional partnerships, are complex. There isn't a single division which just has linear relationships. And the thing about complex systems, which I've been listening to a few podcasts on complex thinking, is that for us to have a true sense, a kind of a deep understanding of how complex systems work, we have to concentrate on how they are connected to each other. So if we only apply kind of a reductionist approach and look at the actors and try and understand them as individuals, without asking how are they connected to each other, we need to understand the actors, but we need to understand the connections. So a simple example is, if you want to understand the behavior of an ant colony, you can't look at one ant. Looking at one ant, you're going to think that this is what an ant colony does. But when you start stepping back and you look at how they connect with each other, the ways of communicating, kind of the role clarification, the common sense of purpose, etc., the sense of being together, now you start understanding, okay, so an ant colony is actually a very highly organized, complex structure that seems to have common purpose. There's clear role clarification. Each one knows what the other one is doing, and because of that, they can survive for generations. And the way of living together is entirely sustainable. Unless there's like a massive external thing like a drought or a flood or a fire or something which comes in, exterminates them. We're not any different. I don't think, and the research into complex systems is that complex systems tend to replicate the same principles regardless of whether they are human complex systems or whether they are animal or insects or plant life, or compound ecosystems made up of all of them. Set of principles that underlie complex systems are replicated across nature. It's quite fascinating. And so, do we know enough about our own systems in which we operate for us to kind of be able to say, well, or is it okay for us just to exist within a system and go with the flow? So the scribble on the right of the screen is what we came up with last week. We actually did some work. Looks like we just scribbled. And I tried to distill that into a few key statements. So where do we want to be? And I think before we talk about operationalizing research, we have to talk about in which values framework is that research going to be operationalized. So I don't think I need to make the argument that we need to learn how to do research. I think it's evident that people within the department can do research. They can raise funds, they can sustain themselves, they can build teams, they can have outputs which have impact. That's already good. The question is, as a cohesive unit, as a department, what are the values that inform that part of our work? And so what we came up with, I've just given words to the concepts that we came up with. That our research is guided by our values. And those values are relevant to the needs of our communities, performed to our highest standards, and infused with humble curiosity. Our researchers are keenly aware of their accountability to society, are supported in ways that unleash their potential, are willing members of a cohesive community of researchers, and have critical contextual awareness. Our efforts change the world we live and work in by foregrounding sustainability in the protection of natural resources, nurturing of human and social capital, producing work of deep meaning, and partnering with funders who value these contributions. pause was not for dramatic effect. I just want people to engage with those statements, and maybe we can come back to it in other words. Probably next week. Okay. So thanks to class for this table, because this gives us a way to start operationalizing some of those. I'm not going to go into the detail of it. It's just that we now, so we are thinking about ways of letting it land in a way that fits into our current work schedules, but still be guided by a set of values which we have mutually agreed upon would become our norms. And so I just want to go through this list quickly I've been told I've got 4 minutes. Huge opportunities that are at our disposal. And I must say, thank Steve and Tracy for procuring the Healthy Futures funding, which in research will fund the establishment of the Family and Community Research Unit. Thanks, Klaus, for your conceptualization of the work. And we're now seeing, as Colleen said, next week we'll be interviewing for a research director. So there's progress towards that at all. I think we have very strong community linkages across urban and rural Western Cape. Maybe one other department in the faculty has those types of connections. Our connections are deeply embedded in the way in which we work within these communities. It is something we need to leverage off of to produce good work. We have very strong working relationships across all the disciplines with the Western Cape Department of Health and Wellness. There are emerging opportunities for interdisciplinary work within the faculty and with the Medical Research Council. Recently I attended a strategic planning session for district health systems for the MRC. They've just sent us the workshop report. Lots of interesting opportunities to engage with the MRC in terms of their 5-year strategy. So I think real meaningful ways to align with what the MRC is doing. I think there's, via Healthy Futures has opened up very interesting engagements with other Western Cape government departments. DCAS, which is Department of Cultural Affairs and Sports, DSD, which is Department of Social Development, and the Western Cape Education Department have all been extremely welcoming of our initial contacts with them, and we've had several meetings with them already in terms of collaborating around community-based initiatives. Amanda's been part of that work. Thanks, Amanda. I think we wouldn't need to work on building connections across Africa and across the world, because all of our disciplines already have that in place. And so those are existing networks which we can start asking ourselves strategically, instead of just saying, where's my next project going to come from? How does the department work strategically within those existing networks? I think point number 8 is that we have proven ability and relationships with funders, some of whom have come back a second and third time to say, we want to give you more funding for a second and third round of projects. I think that's probably a good sign to say that our values align and they respect the type of work that we're putting out into the world. And then currently we've got 3 editors of fairly major journals sitting in the room. And we've got previous editors also in the room. And so we've got a kind of a fairly strong track record of research governance outside of the university, which we can also need to leverage off in terms of, if we're saying, we need to expand the pool of researchers who can have impact. We have the people within the department who, for free of charge, will help us get there. So this is the proposed structure for getting us somewhere beyond today. This block, I don't know what color that is. I'm colorblind. So this block here is the community. That's the components of what our proposed research advisory board for the department, which we're proposing would meet 6 monthly. The research advisory board gets together and talks to the exco and talks to the research director and says, this is the type of work you've been doing for the last while. we suggest this, we suggest that. So it's an advisory board. And important that we include our key partners, our community stakeholders, and our students, our postgrad students who are at the receiving end of our supervision. So that's a 6-monthly engagement. On a monthly basis, the research director would report to EXCO, and we would mandate that research director to convene a quarterly research forum addressing any either emerging research that's been published or presented, but also to address any capacity building issues that are coming from wherever in the department they come from. And what I'm proposing is that there are 3 key areas that we can measure the outputs of our research activity. The one is in terms of capacitated staff, the second is in terms of sustainability, and the third in terms of accountability. And why I'm saying this is because I mentioned earlier that I was worried about impact measurement. And I'm proposing that these 3 domains would help us think about how to start measuring through impact. So I'm done now. So we have internal capacity, and we are, particularly in our PhD area, we're seeing some internal cohesion emerging as people are co-supervising. We've been overtly and intentionally value-based in our thinking around research going forward. We are also very open about our transformative agenda, the why, the who, the what, and the how of research. Why do we do this? Who does it? How are we doing it? With whom? We've procured significant funding, and I think we need to work wisely with what we have. Multiple opportunities for local and global collaborations. And then we come with this unique lived experience of being community-based. And I think that is something that almost more than anything else propels us as a strong voice into faculty and university right